8, therapeutic relationships. So therapeutic relationships are the foundation of the art of psychiatric nursing, and they are necessary for healing to occur. Now, there are several concepts that are central to the nurse-patient relationship, but patient-centered care is the gold standard of healthcare, no matter what area of nursing you choose to go into. Patient-centered care is going to focus on dignity and respect for your patient, information sharing, patient and family participation, collaboration in policy and program development, but you're also going to develop clear and appropriate boundaries with your patients. The therapeutic use of self is using your gifts and your talents to aid in the healing of others. So talk therapy is performed by advanced practice healthcare providers, so those nurse practitioners, physicians, and it's based on models of psychotherapy. There are basic level psychiatric mental health nurses, and they can perform counseling techniques and therapeutic relationships. But the best treatment for most psychiatric problems is a combination of medication with psychotherapy. So goals and functions, they facilitate communication of distressing thoughts and feelings. They will assist the patient with problem solving, help patients examine self-defeating behaviors and test alternatives, promote self-care and independence, and they provide education about disorders and treatments. All right, so personal versus therapeutic relationships. A personal relationship is very different from a therapeutic relationship. So a personal relationship, it is initiated for the purpose of friendship, socialization, enjoyment, or accomplishment of a task. You're going to meet each other's mutual needs. You communicate to give advice or ask for help. And the content of your communication is superficial. But a therapeutic relationship is the ability of the nurse to engage in interpersonal interactions with a goal-directed manner to address patient needs, and this is the foundation of the therapeutic nurse-patient relationship. A therapeutic relationship, the needs of the patient are identified and explored, clear boundaries are established, problem-solving approaches are taken, new coping skills are developed, and behavioral change is encouraged. A therapeutic relationship addresses the patient's concerns, respects the patients with decision making, and uses language that is straightforward. The focus is on the patient's ideas, experiences, and feelings. So boundaries. Nurses are responsible for maintaining the boundaries in a nurse-patient relationship. Boundaries are defined as the accepted legal, ethical, and professional standards that separate nurses from the patients. But there's boundary crossings. There's over-involvement. And over-involvement can increase the risk of boundary crossings, boundary violations, professional sexual misconduct, and the blurring of roles. So let's do some definitions here. Boundary crossings. These are the least serious, and they don't actually violate ethical standards, but an important thing is to realize when boundaries are being crossed and you need to bring it back to a safe and established relationship. The box here on page 127 gives you some behaviors that indicate that a boundary is being crossed. Boundary violations. This is taking advantage of the patient's vulnerability, and you cross over into being ethically wrong and are also harmful to the patient. A role reversal occurs where the needs of the nurse are being met instead of the needs of the patient. Professional sexual misconduct is the most extreme, but it is the least common. It may be physical or verbal, and it can result in malpractice, loss of licensure, and damaged reputation. So the blurring of roles. This is that transference and counter-transference that we talked about in Unit 1. Transference is the displacement of feelings from the patient to the nurse. It usually occurs when one person has a position of authority, and it can be positive or it can be negative. Counter-transference is the displacement of feelings from the nurse to the patient. It's the common sign is over-identification with the patient, and recognizing counter-transference maximizes our ability to empower our patients. So Becky, 19, has been readmitted to the hospital for an episode of debilitating depression. Becky has bipolar disorder, the depressed type. I was already hospitalized for this last month, she says. This is stupid and hopeless. Becky is withdrawn and prefers to lie on her bed. When she must join others in the community room or for her first group therapy session, she sits with her feet curled under her and stares out the window. At times she seems to be holding back tears, at other times she looks angry. You are about to initiate your first contact with Becky, which is the most suitable goal in establishing the therapeutic relationship. The answer is C, establish clear boundaries while identifying patient needs. You notice that you look forward to talking to Becky because her dark sense of humor reminds you of your best friend in high school. You also begin to make little cynical jokes, hoping to have a good laugh together. What is this relationship showing early signs of? D, counter-transference. So, as nurses, it is essential that we not only understand and accept our own values and beliefs, but also we are thoughtful to and accommodating of the distinct values and beliefs of others. So self-awareness requires that we understand that we value what we value and those beliefs that guide our behavior. Being self-aware helps us to accept the uniqueness and differences in others. Now, we talked about Hildegard Peflau in Module 1, but we're going to talk a little bit more about her today. So just refer back to your old notes for her, who she is and her theory. But the nurse-patient relationship enables forward movement for both the nurse and the patient so we can move forward. Any contact that is caring, respectful, and showing concern for the situation of another person can have an enormous impact. Now, Peflau says there are 4 phases. There are pre-orientation, orientation, working, and termination. Now, the pre-orientation phase is when you research your patient's history, and you need to recognize your own thoughts and feelings about meeting this patient, which may not seem like a big deal to you, but what if the patient you're meeting is a child abuser? What if the patient you are meeting killed someone? You do have to recognize your own thoughts and feelings before you meet the patient. And you need to anticipate and set ground rules before the first meeting. Now, during the orientation phase, this is the first face-to-face encounter with the patient, and the nurse conducts that initial interview. Introductions are your very first step. Then we need to establish rapport. There needs to be trust and understanding between the nurse and the patient. There needs to be parameters to the relationship so that the therapeutic relationship is very clear and it's concise. A contract. This contract can be written or verbal, and it includes what the patient's responsibility is and what the nurse will do with the patient to help in meeting the patient's needs. In confidentiality, this is a very important part of healthcare in general, but especially in mental health. Patients have the right to know who the information will be shared with. This is an ethical and legal responsibility that you have as a nurse. The working phase includes exploring areas that are causing problems in the patient's life, as well as implementing coping mechanisms. Patient education is crucial during the working phase. And finally, the termination phase. Termination is actually discussed during the initial encounter with the patient, and it's discussed during the working phase because this helps prepare the patient that this will happen. During the termination phase, you summarize the goals and objections that were achieved. You discuss ways for the patient to incorporate new coping strategies that they have learned. You review situations of relationship, and you exchange memories. So the termination phase can create feelings of loss or guilt from the healthcare provider. Follow-up care should be discussed, such as outpatient care or even self-help groups. So there are several factors that promote patient growth. Genuineness is being open and honest with the patient, and this is key to building a trusting relationship. Empathy, not sympathy. Empathy is the ability to understand another person's perspective and put yourself in their place. It is different from sympathy and is an attitude rather than a technique. Positive regard, which is respect for another person. Attitudes is the willingness to work with the patient as opportunity and not opposition. Actions, helping the patient develop resources and eliminating judgmental thinking. Attending, a special kind of listening that refers to being present with the patient and comes in the form of posture, eye contact, and body language. After your first conversation, Becky withdraws from you again before you've even really begun. Which statement will contribute most to establishing Becky's trust? B. It must be discouraging to be readmitted to the hospital so soon. Showing genuine concern for the other person's circumstances is important in this statement. Becky tells you, I have something secret to tell you, but you can't tell anyone else. The nurse agrees. What is the likely consequence of the nurse's action? B. Blurred boundaries of the nurse-client relationship. Keeping secrets indicates the nurse is overly involved and is one aspect of blurred boundaries.